Welcome to the Grange Clinic Edit, our plastic surgery podcast. I'm Aenone Harper, Machin, consultant plastic surgeon.
And I'm Miss Parneet Gill, consultant plastic surgeon as well.
And today we're going to talk about everything eyes, including surgical, non-surgical management, how to rejuvenate what's called the periorbital area, around the eye and upper face sort of issues, really.
And then the coffee machine goes off.
Typical podcast, first world issues. So, Parneet, how would you assess somebody as suitable for having a blepharoplasty then?
Okay, so it's a really common sort of issue that patients come with. They always want to look a bit sort of less tired, a little bit more rejuvenated around the eyes. So I guess when you assess the eyes, it's not just the eyes that you need to assess. So in terms of the upper eyelid, that's separate from the lower eyelid, obviously. So when assessing the upper eyelid, we're looking at whether there's a lot of excess skin, what the texture of the skin is like, if there is a lot of fat pad protrusion. And by that, what I mean is where the contour is not as snatched in. You get a fullness, usually around the medial eye area, which patients don't tend to like.
The inner corner of the eye, for anybody that doesn't know what medial eye is.
Yeah, so basically, you know, what we're trying to do is improve the contour of the eye, the appearance of the skin, and all of that will add to making the eye look a bit more youthful. So that's just the upper eyelids.
Yeah, and I find that people come in and say, either I need my eyes doing, or I feel very tired, I get a lot of headaches and things like that. And actually they're not sometimes appreciating that the brow can contribute to that upper eyelid heaviness as well, with also a wee bit of hooding over the front of the eye and things like that. But in general, I would say we deal mostly with people with a bit of excess skin, a bit of fat bulging in the inner corner of the eye, certainly for the upper eyelids and things.
And usually, especially with ladies, they come and say, oh, you know, I'm finding it really hard to put my makeup on. Or actually, there's not much place to put the eyeshadow in. Or my mascara keeps touching my upper eyelid and, you know, it's getting messed up. So it's those kind of issues that tend to present quite often. But, you know, you don't always need to have surgery. So the assessment's really important. So if we stick with the upper eyelids, for example, if there's not much excess skin, but it's just more that there's, you know, wrinkles, tissue paper type skin, then actually we don't need to rush to surgery. Laser CO2 resurfacing is actually a really good alternative. And I do discuss this, especially with the younger patients who don't actually have much hooding or heaviness of the upper eyelids, but they just want a little bit more tightening. So, you know, just because you've got loose skin that's only, you know, slight or not very good texture doesn't always mean you have to rush to surgery.
No, and you don't have to do surgery. And plus I find, certainly for a non-surgical kind of maintenance of the look and refreshing the eye area, then toxin is a very good way of addressing a lot of the crow's feet, a lot of the difference in the skin texture and things like that. And you can also do a little bit of a chemical brow lift with toxin just underneath the outer corner of the eyebrow, which pulls the brow up and can kind of refresh or rejuvenate that eye area. So I think toxin's quite a powerful way of kind of addressing the eye area, certainly with non-surgery, and also even if you do have surgery, maintaining kind of that look of periorbital around the eye rejuvenation, really. So
I think combining techniques and different procedures is definitely the way forward as well. So toxin, you know, reduces the dynamic movement. So when you're moving, you know, when you're smiling, you get those fine lines. And what the botulinum toxin does is just reduce the activity of that muscle to stop those dynamic lines.
I don't get those anymore, courtesy of Miss Gill. So I'm trying. It works. Yeah. So and just keeps that whole area kind of smooth, because that's often, certainly for lower eyelids, I often get patients coming and saying, when I smile, I get that roll. And it's a dynamic thing. It's not to do with eye bags particularly or anything like that. That's actually how your orbicularis muscle, so the muscle that's a big circular sling around your eye, actually works. So when you smile or animate your face, move your face, you get that roll underneath your lower eyelids. And no surgery addresses that. Toxin can be quite good, but that is how your face works. That's a dynamic thing.
And you want to look natural as well.
Yeah,
you don't want
exactly.
to, when you smile, you don't want to have a strange looking smile around your eyes as well. So it's all got to be very natural. And then, now if we're moving on to the lower lids, so the lower lid assessment is very different to the upper eyelid assessment.
Sure
so
is.
It's very important to assess the skin laxity as above, but also assessing what the quality of the lower lid margin is like as well. So when I'm assessing patients for lower lid blepharoplasty, that's lower lid tightening. I look at how much skin needs to be removed, how much fat there is, which is often at the medial part as well. So that's the inner eye, lower lid area. But also, as we age, we do get more hollowing of the eye. So there's loss of volume as well as sagging of the actual skin. And that can obviously make everything look very tired.
And I think that's known sort of on Instagram as like a tear trough deformity. And people will be familiar with that more on a social media front in filling out tear trough or using kind of non-surgical techniques for rejuvenating that eye area.
But it's quite, I mean, I'm sure a lot of patients, you guys have heard of tear trough fillers, and a lot of people are quite afraid of getting these done because they have been done quite badly at times. And so it does make it quite difficult. We do get patients that have had it done that come for rejuvenation, and often you do have to dissolve the fillers. Or remove them. If I have had to remove them before as well when I've done low lid blephs, because they've been sitting in a pocket causing a lot of distortion. So I do low lid tear trough fillers. So it is a good technique when it's done correctly in the right plane. So you do need to, if you are considering having it done, make sure you go to someone who knows what they're doing. And less is more with tear trough fillers as well, so you don't have to have a large volume put in to get a good result. And in fact, I tend to build up the volume over time rather than putting a whole load in. It allows the skin to stretch a little bit, and they work well when there's not too much lower lid laxity. So if you've got quite a lot of lower lid bags and you've got a lot of loose skin, putting in more volume is not going to be the right option. And that's when people do make mistakes where they just put volume in and it does not rejuvenate the eye. It often makes it look worse. So again, the assessment is so important to see what it is that actually needs to be addressed. It's not just a case of putting filler in or just tightening the lower lid. You have to really look at what it is that's causing the eye to look tired.
So who's a great candidate for a lower eyelid bleph? Because from a surgeon's point of view, the technicality of doing a lower lid blepharoplasty far outstrips the technicality of doing an upper eyelid blepharoplasty. But I know a lot of people will think, actually, because the upper eyelids move more, that it's a more technical operation. But I think the direct opposite is true.
Completely agree with that. Yes. And it is because when we do lower lid blepharoplasty, we are going into the deeper tissues, really. When we're doing the upper lid, we tend to remove, skin, a strip of muscle, and resculpt the fat a little bit. But actually, beyond that,
not much.
We close it up, and as long as the lines are in the correct place and it's very symmetrical, it looks really good. And from a surgical point of view, that's pretty straightforward. And obviously, you do a lot of other big, free flap reconstructions and big cases which are far more technical. However, in order to do a good, very nicely, done upper lid blepharoplasty, that does take skill as well.
Yes.
Comparing that to low lid blephs, apart from where to put the actual scar, we also have to protect the lower lid function as well.
Yeah.
So, we have to make sure that the main risks are, the lid can be pulled downwards like that. That's called an ectropy, and that can cause a watery eye and obviously not look very nice. So we're trying to protect that lower lid from being pulled down. So often, I tend to tighten all the lids that I do low lid blepharoplasties on. So if it's a fairly young patient, often they just need a tightening, so a canthopexy. If it's a slightly more mature patient, the lid may need to be shortened and tightened, and that's a lateral tarsal strip. So again, that assessment is so important to see. We do like something called a snap test. We look at the vector of the eye. So all of that allows us to sort of decide exactly how much we need to sort of do in terms of keeping that lid supported. And then I think we do similar things in terms of, we do a SOOF lift and support the mid face as well. So when we're doing a low lid blepharoplasty surgery, it's not just a case of tightening the eye, it's a case of supporting the mid face as well. And that in combination will give you a much nicer, more youthful result rather than just doing a tightening. So therefore it is far more technical. You're not just cutting out skin and tightening. It's way more.
And certainly utilizing kind of the patient's own tissues. So yes, often people have a lot of fat prolapse as we age. So the fat sort of bulges out and that's what causes your eye bags. and actually utilizing that fat to smooth out the bony junction between the cheekbone and the lower eyelid. Just gives you a much nicer contour. So instead of it bulging, we can utilize it to smooth that out and actually augment the volume in a small way, which is just enough to give you that really nice kind of refined lower eyelid look without stripping out the fat, which again is a problem. Because the more volume you lose as you age, the more hollowed out and kind of older the eye area can look.
So that skeletal appearance, isn't it, that we're trying to avoid?
Yeah.
And you do a lot of fat transfer as well, don't you, for eyelids?
So utilizing people's own tissue as opposed to using fillers. Plus, you get the stem cell regeneration, so the improvement in the collagen and the strength of the tissues from performing the fat transfer. So I do, I wouldn't. It's people come and ask me for fat transfer to the lower eyelid, and I think it is a really good technique for addressing people with not a lot of skin laxity, maybe some crepiness to the lower eyelid area, that have a wee bit of a tear trough deformity or volume loss, that want to just rejuvenate the periorbital area. I've also done a few people where the fat has been removed at some point in the past. They've had a lower lid blepharoplasty and they feel a wee bit hollowed out. So just replacing that fat with fat, basically.
And do you find that improves the skin quality as well when you've done that?
For sure. As I say, that's that sort of regenerative quality of fat and how you process it. Just really improves that skin condition, thickness, collagen, that type of thing. So and it's all your own tissue and can be relatively straightforward and harvested from basically anywhere you like, tummy, side of thigh, that type of thing.
All the bits that you want to lose, basically.
Exactly. Although it's not quite like formal liposuction, it's only a small amount. But if you're just doing small volume fat transfer, but large volume fat transfers for another podcast. I think
that'll be another day. So I guess just to round things up, with blepharoplasties, that's one option. However, with periorbital, or basically around the eye rejuvenation, there's so many different things that you can do, starting from simple things such as skincare. So SPF, retinol eye creams, hydrating eye creams such as caffeine-based eye creams. So there's so many different things that you can do to maintain the quality of the eye area. But, you don't have to jump to blepharoplasty. There are other options such as laser resurfacing, such as fillers, such as, both botulinum toxin. So there's so many different things that can be utilized before you take that big step into surgery. But even with the surgical step, I would say it's probably one of the most rewarding surgeries where you do see a very rapid improvement. On the table, you can see how much improvement the patient has got. So, and after the few weeks where the swelling settles down, it definitely reduces your age by 10 to 15 years, depending on how much tightening you've had done. So it's one of my favorite procedures, blepharoplasty, for sure.
And I suppose from our point of view, certainly I've had a lot of I've been told I can only have my lids done under a general anaesthetic, particularly for lower eyelids and things. And I know you in the health service do a lot of major kind of cancer resections and eyelid reconstruction, all under local anaesthetic.
Yeah, it's possible. You've just got to be very patient and take it
slowly. If you can remove somebody's entire lower eyelid and make them a new one out of little bits and pieces from the surrounding area, then a lower lid blepharoplasty under local is no real great trouble. As long as that's what the patient wants, I guess. And
we can also give them a bit of sedation as well. So often it's just a case of, taking it slowly, explaining to the patient, what to expect. And I've, touch wood, I've not had any, issues doing low lid blephs with local and a bit of sedation. So it works really well. You don't have that general anaesthetic hangover the next day. And, it's safer because you don't have to be put to sleep. But like you said, you have to pick the right patient.
And I find as well, the dynamics of the eye are preserved under local because the patient is conscious. And so they can open their eye or move it or, you can kind of check certain things that you can't under a general anaesthetic.
Definitely. So I, often with the little bit of sedation, patients can sometimes fall asleep because they're so relaxed. And you do have to wake them up to say, okay, let me have a look and see, to symmetrize. So sometimes I've had to wake patients up. But yeah, and the main thing I tell patients as well is because you are awake, if you get any pain behind the eye, because that's the other thing that we do have to talk about is with mainly low-lid blepharoplasty, there's a very, very rare risk of blindness, which has been reported. But even though it's very rare, it is a significant risk. So obviously we consent patients for it when they come for low-lid blepharoplasty. Yeah. And what I like about doing it under local is that if the patient is getting any pain from the blindness is caused by bleeding behind the eye. That's what tends to cause it. If they're getting a lot of pain behind that eye, if there's a lot of swelling, we can tell straight away on the table, and it can be, dealt with straight away.
Well, people say to me, how will I know? And I'm like, you can't ignore it. It's a pain that feels like a stabbing behind the eye. And it's because if you get some bleeding or a collection of blood behind the eye and it puts pressure on the eye, then that is painful. And if it's untreated, i.e. you don't do anything about it, it can lead to blindness. And the treatment is to release that little bit of bleeding or that little bit of pressure behind the eye. So that's probably the headline complication that if it were to happen to you, would be something that might change your mind from having surgery. The other biggie is the ectropion or
the lower lid being pulled down.
For the upper eyelid, I guess it's our job to make it look good, i.e. remove enough skin that it looks really nice, but not remove so much skin that you can't close your eyes, which is known as lag ophthalmos, or the inability to close the eye. And that is, I suppose, ameliorated against, I use a pinch technique. So I will mark the eyelid crease where the incision is going to start, and then pinch the upper part of the skin and mark and measure how much skin I'm going to take away. And it can be different on both sides. Like you can have a worse, amount of skin on one side as the other.
Often it is. They always say, eyebrows are sisters, not twins. Your eyelid's the same. There'll always be one slight difference.
Yeah.
Depending on how you sleep, just depending on your skin quality. I've never ever excised exactly the same amount of skin from the upper eyelids. No, I'm sure you probably haven't. But I guess the point is, we're assessing what the final appearance should look like.
Yeah. And
sort of, it's a made to measure cut as you go sort of technique where, you need to nip it in a little bit more. We do, don't we?
Just adjust it.
So it's quite nice. It's quite creative.
Stitches wise, just to sort of round it up, I have toyed around over the years with doing various different things, and I think we've now landed on pretty much the same suture. We use a non-dissolving, so one that needs to be removed, but it runs underneath the skin and just gets slid out at 5 days. It's like a little blue stitch. And then paper strips to secure that. We don't tend to tie any knots in it. Occasionally we'll put one or two ones where there is a little knot that it needs to come out, but for the most part it's just a slide out stitch, and it's a really high satisfaction rate operation. So I hope you found it informative. Thank you for listening to our podcast, and we'll see you next time.
Oh, and if you've got any questions, put it down below so we can answer your questions directly, but we'll be talking about a lot of other things soon as well.